important. So let me share the screen.
My children.
Oh, okay.
Sọ pé wọ́n káre jàre àwọn ọmọ dáadáa, àwọn ọmọ wa ọmọ ẹkùn.
You should come and form a band with
Teniola.
Adio.
Okay, we're live.
Ìní àti Fúnláyọ̀ kan join. Àwọn ọmọ wa morin kọ.
Okay.
So, ṣé kí n bẹ̀rẹ̀?
Yes.
Okay. You're welcome to Mental Awareness Part 2, everyone. So last week, we talked briefly about overview of mental awareness, literally. But this week, I'll be going through each disease process and all the categories. Then at the end of the day, we'll talk generally about treatment options available there. So the objective of today is to talk about the brain itself, like, okay, what's going on in the brain? What happens in the body? Then also, like I said, we review the diagnosis, classification of different psychological disorders, and understand the symptoms that are associated with each specific mental illness. Then we'll also talk about available therapy and treatment options. So let's talk about human brain. I tried to break it down as much as I could. So brain cells are called neurons. Humans, we were born with at least 100 billions of neurons. Then we have dendrites that are the fibers that grow out of the neuron when we listen, write, talk, or practice. So the neurons grows dendrites, which is learning that is equals to growth of dendrites. Do you understand what I'm saying? Like when you grow dendrites or you're learning, so of course that's growing. That's the fiber that is growing as you use all this neuron. So the new dendrite takes a lot of practice to develop. So they take time to grow. It's just like you want to learn a skills, your dendrites will be growing. If you don't use your brain, it's dormant because you're not activating your neuron to learn. So you have to like use them. So when two dendrites grows close together, then they form a contact point. The gap between the two dendrites, we call it synapse. Messages are now sent from one neuron to another across the synapses that they form. So which is what we call the electrical impulses or the signal that connect the two dendrites together. So in the brain, let me move this, okay. Some scientists or researchers believe that an imbalance in brain chemicals contribute to mental illness development. So this imbalance disrupts the brain activities to transport messages from one neuron to another. So this also affects the brain wiring to function normally. So as a result, in this breakdown of function, brain may not communicate properly. So when brain is not communicating properly, of course, the communication with the body is cut off. Then the person may start showing symptoms of mental illness. So I talk about part of human brain here, those important parts, you know, the frontal lobe, which is actually responsible for all the executive functioning. That is where you have your ability to concentrate, to actually think through stuff, and also some memory aspects of it too. Then you have the parietal lobe, which is actually for your visual and attention. And also, it's also helped the body to perceive stuff as well. Then you have your temporal lobe, which is actually help with memory acquisition as well as your ability to hear also. Then occipital lobe is primarily for vision. Then we have the brain stem. That one is also called spinal cord, which is very, very important in human.
Hello, Yinka.
Yeah.
Can you press F5 on your computer?
F5?
Yes. So we can.
I did.
Didn't you?
No.
F5 is supposed to put it in presentation mode. Can you click that presentation? Go and click like a presentation mode.
At the top of insert.
Right here?
No, up. Yes.
Okay. Oshé.
Thank you.
Good. We can't hear you. Okay, good.
Okay. So the spinal cord, like I was saying, also we call it the brainstem. That is where that controls your heart rate, your breathing, your ability to see and hear as well is there. Your startle response also is controlled by that. It controls your sweating as well, or anything that has to do with body regulation, that controls it. So if somebody gets in an accident and actually suffer damage to the brainstem, that person is dead. So they will say, oh, that person is brain dead. So just pulling everything together, that's how important our brain is. So in all this area of the brain lobes, some chemicals are produced, like acetylcholine is produced. If it's too much, then you have depression. If it's too little in the hippocampus, then that's dementia. Dopamine is also secreted. If it's too much, schizophrenia. If it's too little, depression. Also, muscular rigidity that you will see in people with Parkinson's disease. Serotonin, I talk about this a lot because depression and anxiety is much more common. So if it's too little, that's depression and anxiety. But if it's too much, that means you are happy. The GABA one, if it's too little, you have anxiety disorder. Norepinephrine, if it's too little, depression. If it's too much, of course, we're seeing that in schizophrenia. Epinephrine, if it's too little, that's depression. If epinephrine is high, that's okay. Adrenaline, if it's too much, it leads to anxiety. And adrenaline is that the chemical that actually control your flight and fright response. So I'm going to talk about mood disorders. The first one I'm going to talk about is the major depression. Major depression is feeling sad, helpless, and hopeless every day for weeks, and include all these features like fatigue, low motivation, diminished interest or pleasure in daily activities, feelings of worthlessness, guilt, suicidal thoughts, difficulty sleeping or sometimes can be excessive, difficulty concentrating, feeling slowed down sometimes or feeling restless is part of the symptoms. The reason why I broke it down like this, before you can merit any kind of diagnosis, this had to have gone on completely for 2 weeks in a row without a break. So I always say over the last 2 weeks, have you had any of these symptoms? Then we proceed to diagnosis. In bipolar disorder, which is also another mood disorder, it is characterized by the state of depression and mania. When I talk about mania, that refers to your hyper-elevated mood, restless activity, unnecessary laughter, euphoria, unnecessary confidence, rambling or precious speech, grandiosity, impulsive and loss of inhibition. So bipolar is categorized into 2 different ones. And even apart from these 2 types, we still have like when someone is in mixed state or so. So in bipolar 1, this is full episode of mania. There is no depression here. In bipolar 2, which is considered a much milder manic state, people have hypomania. And also there is also agitation and irritability, which is very, very prominent with bipolar 2. Average onset of bipolar illness is in the 20s. Children do have bipolar, but we don't classify them yet because we don't know if it's the growing stages that is contributing to the symptoms. So we treat it as mood disorder. But after 20s, we start treating for bipolar disorder. Brain use of glucose increases in manic states and is reduced in depressive states. Another mood disorder happens with season. We call it seasonal affective disorder. So it's a type that is related to season changes. And it begins around the same time every year. Some symptoms may start in winter months, but I've seen some people that actually have depression around springtime or early summer. So this is another type of depression that we will see. And specific causes may be biological clock or circadian rhythm or drop in serotonin level or melatonin level. Melatonin is actually what helps us also to rest or sleep better. So some people just don't in the spring or summertime or in winter months. Winter months is mostly dark here. So I know in Nigeria we have fall and dry season, right? We have 2 seasons, right? Oh my God, I need to go. Well, so in rainy season, it's a little cold. So some people, biological issues may ensue because that time you're having joint pain, especially those with arthritis. They may start having a lot of pain and aches in their body. So it might be biologically explained why they're having depression around that time. And those who are not sleeping very well, of course, that's going to show. And those who have some chemical imbalances. Then in seasonal affective disorder, most of the time I don't go straight for medication. I try to use light therapy. Sometimes they buy this specially formulated light and just turn it on at home when it's getting dark. It does help the depression. And sometimes we use psychotherapy, or sometimes when everything else don't work out well, we try and put a person on antidepressants. Another form of mood disorder is postpartum depression. This is this is very common around here, and it affects women. Sometimes we may see the symptoms before giving birth, but most of the time it shows itself after giving birth. And about 20% of women it affects about 20% of women, but most do recover really quick. And it is more common among women who have been diagnosed with depression before. So as it's associated with reduced progesterone or estrogen level. These are the hormones in women. And I wanted to say here that also in men, I've seen where testosterone reduction is associated with their depression too. So moving from this mood disorder, I'm going to talk about anxiety. So the first one I'll start with is generalized anxiety disorder. It is described as continuous states of excessive or pointless worrying and apprehension about everyday life. So most of the time it's diagnosed when an individual experiences difficulty to control worrying for at least 6 months, for 6 months straight. And the worrying is so challenging to control that you can't even shift at all from one topic to another. So it occurs in both adults and also children. And this worrying is also attended to by at least 3 of these other symptoms, like edginess or restlessness, tiring easily or more fatigued than usual, impaired concentration, or feeling as if the mind goes blank, irritability, which may or may not be observable to others. Some people are irritable and don't really show it because they internalize everything. Increased muscle ache or soreness, or sometimes might be unexplained pain. Some may have chest pain or chest tightness. Some may just tell you that, oh, I'm having stomach pain. Then another one is difficulty sleeping. It may be trouble falling asleep or staying asleep or restless at night or not feeling restful when you wake up in the morning. Another form of anxiety is the post-traumatic stress disorder. We touched about this briefly last week. And post-traumatic stress disorder is called a shell shock or battle fatigue syndrome, which develop after experiencing or witnessing traumatic or terrifying events in which physical harm occurs or your physical stuff is threatened or you feel you're in danger. So the symptoms may include reliving, like you repeatedly reliving the traumatic event. That is having flashbacks, the event is showing up as nightmares, or you distress if certain things around you remind you of that trauma. Another symptoms that you notice is avoiding. Like people may start, yeah.
Can you please go through that again?
The reliving?
Like the whole PTSD thing.
Okay.
Okay.
So PTSD, actually another name we call it, the late term is battle fatigue syndrome or shell shock syndrome. It develops after experiencing or witnessing traumatic or terrifying events in which physical harm occurs or threatened. For example, you may not be the one that it affects directly, but you may have witnessed that. Let's choose, for instance, in case of domestic abuse. The children are watching. These affect them because they've seen what is going on. They don't like it, they can't do anything about it, but they saw what's going on. So, of course, some may have nightmare about that. It depends on how sensitive or how strong that child is. So, that's why I'm specifying that this may not be like something that directly happened to you, but you witnessed, so you saw. But you felt that your life was in danger or your physical harm has actually been threatened. In some cases, physical harm do actually occur. So the symptoms that you notice with people with PTSD is that they relive repeatedly what happened. Like they go through the traumatic events in their mind. Like they have flashbacks about it, they have nightmare about it. If certain things remind them of that trauma, that's trigger the feelings again. For example, let's talk about rape. Let's say somebody that is 6 feet built and strong, rape somebody. A lady may try to stay away from someone that reminds them of that. They may be threatened just looking at someone that is built like that person. Not because the person did it, but because, okay, that's how that person looked like. They may want to stay away. I've seen some come and be like, okay, I don't want to deal with male, I want to deal with female counselor. Can you put me with a female counselor? So some just don't associate, they don't even work well when they find themselves surrounded by that. So they can't deal until they work out the process because it triggered that. Some may just watch the news and see something that reminds them of that. It may be a movie that reminds them of what they've been through. So that triggered their feelings. Then avoidance, like I mentioned, they may avoid people, they may avoid places, especially somewhere that remind them of that taking place. I have one that was actually sodomized in a Catholic church. He doesn't go to any church at all. And any passing by a Catholic church, he stays away from. So because it reminds him of that trauma. Then there is increased arousal. Now that is the adrenaline working, the body system will create that type of vigilance. Like, okay, I need to hasten out of this place. This is not where I have to be. So some may experience outbursts and just like lash out. Some may start hyperventilating. So they may start breathing hard, being short of breath, can't catch their breath. So that may happen. Then there is also negative thoughts and mood, which is encompassed with like blaming oneself, separating oneself, which I call estrangement, and also having memories from that traumatic event. So that may trigger mood disorder as well as negative thoughts. Some even go hurt themselves because they feel so guilty that, oh, is it because of me that dad and mom were fighting? Or is it because of me that I was raped? Did I go there? Or is it because of me that my colleague died at the battle? Could I have guided them better? They have this guilt also and try to internalize all these things and blame themselves. Some end up killing themselves because of that. Another form of anxiety disorder is obsessive compulsive disorder. OCD is characterized by the presence of obsessions and compulsion. But these are so recurrent and persistent. So you have that thought, the urges, and the images that are very, very intrusive and unwanted. Compulsion, on the other hand, they are repetitive behavior, like something that you just have to do, or you cannot stop obsessing over it. So according to rules, that must be applied rigidly. So I call it the ritualistic behavior. Some other obsessive compulsive related disorder are also characterized by preoccupations, by repetitive behavior, mental acts in response to the preoccupations. Other OCD and the related disorder are actually primarily by recurrently focusing on repetitive behavior like hair pulling, skin picking, repeated attention decrease, and also several attempts to stop the behavior. Common obsessive symptoms may include fear of dirt, contamination by germs, like fear of making mistake, need for order, symmetry, or exactness, excessive doubt, and constant need for reassurance. Common compulsion includes repeated showering or washing hair, refusal to shake hands or touch doorknobs, repeatedly checking things such as locks or stove, constantly counting mentally or aloud when performing routine tasks, arranging things in a special way or a certain way, eating food in a specific order, and collecting or holding things with no apparent values. With obsessive symptoms, I want to talk a little bit of that. Like President Trump does have fear of germs. He has bisophobia. And because of that, I think that's what contributes to him not being able to shake hands with someone. So that's what they said. Yeah. Another one is Steve Mendes. He also has a fear of germs, so which is a form of OCD. So some people are so obsessed with the fact that they don't want to make any mistake. You see them in the office, they spend so much time on one task because they're checking it for error over and over again. Then it makes them less productive and also at the danger of losing their job. Some just need stuff arranged in a way that if they don't have it arranged in that order, they can never rest. It may be same exactness, it may be symmetry. Those ones are the ones that are arranged, and sometimes we call them neat freak. So those who have issues with contamination by germs may shower repeatedly or wash hands so frequently to the sense that their hand is so dry and is cracked. They don't shake hands, they don't touch doorknob. They have to have something else to touch the doorknob because of the fear of being contaminated by germs. Other people that are afraid of making mistake, oh, did I leave that stove on? Did I lock my door? They may come back home several times to check, to double check to make sure they didn't leave anything on. So these people may be late to work habitually. They may actually not be restless at work because they're thinking about what's going on at home, so which distract them from what they should be doing. Then there are those that can't mentally or allowed, or else they will not be able to perform their routine tasks. Then I also mentioned eating food in a specific order. If that food is not eaten according to the way that you want to eat it, it may cause stomachache or whatever, which is psychological to them. Then another form is collecting and holding things that have no values. I've seen people hold newspapers and they don't even need it, but they have a room full of all this stuff that they don't need. So moving on to schizophrenia, which is another one that affects a person's mind and as well as mood. I call schizophrenia when mind is split from reality. It changes how you see things, how you think, or how you perceive things. Symptoms vary, and all symptoms may not show up all the time. So, in another word, because somebody have schizophrenia doesn't mean they will have all these symptoms. So I separated the symptoms into three ones that we see. The positive symptoms are the hallucinations, So the auditory hallucination, the visual hallucination, the tactile hallucination will be present. Then there is delusions, thinking that you have superpower. Like, oh, thinking you're the president, thinking you're supposed to be president yesterday when you didn't, thinking you're the one talking from TV, things like that. There is confused thought and speech pattern that you see. People may have strange behavior. One leg, they can actually wear several clothes together and not even know. So you notice this strange behavior. Or hard, repetitive way, like walking in circles. They may be chasing their tails around, walking like that, or pacing, or sitting still for hours without moving a muscle. I've seen that. So called that catatonia. So those are positive signs that you see. The negative symptoms are the apathy, when someone is just sitting there and very, very withdrawn, emotionless, depression, struggling with life basic things, and not able to follow through anything. Now, the cognitive symptoms is like having the hard time with working memory, issues paying attention, and how to organize thoughts and make decisions. You notice that a lot with the cognitive symptoms. So like I said, all these symptoms don't show at the same time at all. So you may see people that will just exhibit maybe a few of it, and you may see some that will have all of it too. So I'll move on to talk about neurodevelopmental disorders. Neurodevelopmental disorders are impairment that are actually growth related. So they literally affect growth and development of the brain function. And it affects the area that actually affect the emotion, learning ability, self-control, and memory. So they show up during growth and development stages. So these include autism spectrum disorder, attention deficit disorder, intellectual disability also is part of it. So I'll be talking about the one that is most common, the autism spectrum disorder. This shows up in childhood. That's why I always say that parents, we have to be very, very included in our child's life to see how they are progressing. So we go for well check for our children. So with criteria A for diagnosis, you notice that social emotional reciprocity, the nonverbal social communication, the reciprocal relationship. In criteria B, you notice repetitive speech or movement or use of objects. Adherence to routine or ritual is seen to restricted or sometimes intense interest in things and unusual sensory interest or reaction. May notice with autism spectrum disorder. So I list all these things so that way we can go through each and what we see with level of severity. So it's not all level that is actually will need a lot of support. We've seen children that are just exhibit what I call level 1, which is like a mild form of it that require only a few supports. So without support in place, you may notice deficits in social communication and also difficulty initiating social interaction or demonstrating clear examples of atypical or unsuccessful responses to social overtures of others. So they may look like they have no interest at all in social interaction. They may not want to play, they may not want to do much there. Then with the rituals, you may see that they have restricted instincts and repetitive behavior, which may cause significant interference with functioning in one or more contexts. So they may resist attempts by others to interrupt them or be redirected from fixated interest. Like, okay, maybe they have interest in a door, you can't break that interest at that time because that's what they're interested in. So they are not listening to anything else that you have to say. So some can be redirected by trained professionals. And actually some parents were taught also how to help with building skills to move from this level. Level 2 need more support, like everything I've mentioned with level 1. And level 3 need very substantial support. Okay, I gotta go back to, oh my goodness. It's not taking me back, so let me escape this.
You can use the arrow keys on your keyboard, though.
Abby, this
Down,
kind of
down.
computer.
Use the back arrow to go back.
Okay, so I was going to talk about ADHD. Thank you. Sorry about that. Okay, so ADHD, which is attention deficit hyperactivity disorder, is a disorder that can also happen in childhood. And it causes above normal level of activities and impulse behavior in adults and also in children. Common symptoms may include having trouble focusing or concentrating on tasks, being forgetful about completing tasks, being distracted, having difficulty sitting still, very impulsivity, interrupting people when they're talking. So this is actually broken down in several categories. When it is predominantly inattentive, people with this type of category, they have extreme difficulty focusing on task or following instruction. So they don't have the jumping around or impulsivity at all. They just can't concentrate. These people, you see them also daydreaming in class. So the daydream have to be very, very like really, really prominent for them to be diagnosed with the inattentive type. There are some that are actually hyperactive and impulsive type. They show impulsive behavior. They may be fidgeting, they may interrupt when others are talking, they can't wait their turn. Like, okay, everybody is asked questions in class, they blot out the answers without even caring whether the teacher tells them to say anything or not. Then you have those who actually combine both, which is both the inattentive as well as the overactivity and the impulsive type too. So they show both of these symptoms that I mentioned on the two type above. So whenever I come across these children in classroom, not everything immediately leads to treatment with medication. Some parents don't even want you treating, whereas some others will actually tell you their child have this kind of condition and they need to get on medication. So the medication we use to treat this kind of disorder is stimulants. So when a child starts on stimulants, there are a lot of things that have to be established because this medication will curb their appetite. And we're talking about children that are growing. So when they don't have enough nutrient that they need in food, it may stunt their growth. So there are a lot of tests that needs to be done before you establish if the child needs the treatment or not. To curb those who fake symptoms, because it can easily be reported, because we have to listen to what the parent is saying the child is showing. We do several tests. We have Vanderbilt test. It's a question and answer based that is actually done in 3 levels. The parent completes one, the child completes one, the school teacher completes one, and they send these forms in for us to look at. Then there is another one that is actually computer-based, which we call TOVA test. So it may be a sort of game that the child is playing with. So the amount of clicks that they do will show if they're having issues with inattention. So that helps us to actually diagnose correctly instead of basing everything on what symptoms is being reported, because it can be inflated. Stimulants make people focus very well, and some parents want their children, or our parents want their children to do well. So, and we don't want them to abuse the medication because it has its own side effects. So because of this, we go through rigorous steps to make sure that things are tested actually and established before starting a child on medication. Some actually don't know they have this condition, they live with it and struggle all their life, and they are diagnosed in adulthood. So these people come with a lot of issues with depression. So when we're treating them, we say, okay, is there any comorbidity to this? Then you find out that there are so many adults that I see now that didn't even know they have ADHD. And they've walked their ways all through their life struggling without getting any treatment. So immediately they start treatment, you see that their work is not affected anymore and they actually lead a productive life. Let me move on. Another diagnosis that I want to talk about briefly is disruptive impulsive control and conduct disorders. You may see this a lot in teens, and some children that are in childhood range also show this. So they refer to a group of disorders that include the oppositional defiant disorder, that no matter what you said, your way is not a way. Conduct disorder, intermittent explosive disorder, kleptomania, pyromania. This disorder can also cause people to behave angrily or aggressively towards others or properties. They may have difficulty controlling their emotion and behavior and may break rules and laws. When a child started showing these symptoms, I always say that please treat it immediately. When a child is abnormally angry, aggressive, disruptive every time, and showing that they can break rule or break free or do whatever, you want to take care of that. So I always say that the behavior needs to be very, very frequent. Because your child was angry for 1 minute doesn't mean they actually have this diagnosis. So it has to be very frequent. It has to last for a long time or occur across different situations and cause significant problems. So most of the children that exhibit this sometimes landed in juvie. This is juvenile detention, because they start fire, burn down buildings, you know, they stole from Walmart or other stores, you know, they show that, okay, there is nothing you can do, and they laugh about it. You know, it may be another comorbidity, may be because they have antisocial disorder. It may be anything. So I always say that you want to do something immediately about that. So, you know, all of us have emotions. Too much of everything is not good. I'll move on to talk briefly about feeding and eating disorder. The number one is anorexia nervosa, which is primarily affects adolescent girls and young women. And I've seen some older people too that actually are dealing with this too. So it's characterized by distorted body image and excessive dieting that lead to severe weight loss and a pathological fear of becoming fat. So the criteria focuses only on behavior that restricts calorie intake. Like these people just don't want to eat. Some will just eat like maybe once a day, and some may not even eat at all. With bulimia nervosa, they eat, they binge eat, then there is inappropriate behavior like self-induced vomiting or use of laxative to avoid weight gain. Then there is binge eating on its own, which you notice also with attending obesity. It's recurring episode of eating significantly more food in a short period of time. Some will rush to eat and they have no control at all when they see food. Some with binge eating disorder may eat too quickly, like I said, or even when he or she is not hungry, they may show that too. Then now I'm seeing some males that are actually coming up with anorexia nervosa. So I wanted to put this out there. So that's why they have to change this category, not to mean that, oh, they have to have this and that only, or they may not have period for 3 months because men don't menstruate. So we only put it and categorize it under the restricting calorie intake type. So it's very, very important to monitor our children, especially when they're growing up, see what they're watching, because most of the time it's influenced by what media wants or what social media is saying and portraying as beauty. So we want to encourage our young ladies and young men that they are just good and beautiful the way they are. Fat shaming people, you know, contribute to anorexia nervosa in a lot of things. So our job is to ensure that we can encourage our children and also help them to open up to talk to us about whatever they are going through. So that way we can actually take care of things before we start seeing symptoms start show. Another one is elimination disorder. People must have noticed this, you know, when your mother sing back in the days, so there are two types. It might be inappropriate elimination of urine or feces, and is commonly diagnosed in childhood, and some actually proceed to adolescent age. So yeah, enuresis is the one with urine, and is a repeated voiding of urine in inappropriate places. And encopresis, repeated passage of feces into appropriate places. So treatment is actually based on symptoms or the exact diagnosis of the type of the elimination disorder. So I always recommend counseling in every case, because I've seen some situation where the child really was just too shy to ask the teacher to use the bathroom in class and end up going on it themselves. Some kids are just so intimidated by their own teachers that they really can't raise up that, oh, I want to go to the bathroom, or they don't have a way of saying. So we try to dig deep into what is causing this behavior, because the time of the day it happens also matters. Does it happen a lot during the day? Is it happening at night? Or is it that when the child eats quickly, could this actually have to do with something else other than what we think? So I always make sure that we do that. We get into the roots of what is going on. So there are specific treatment programs that actually integrate cognitive behavioral elements. So like nighttime bedwetting, we treat it with alarm, like set alarm for this child to go to the bedroom. Sometimes I may say, oh, cut off water drinking at so time of the evening, so that way they don't wear the bed. And kids' kidney, bladder is just developing, so they don't hold much urine anyway. So toileting them before bedtime is always a key to prevent bedwetting. Some, there is nothing you can do. We have to put them on medication like desmopressin. And some may just have issues with urge. They don't know that they want to go. So we treat those with anticholinergics like oxybutynin. And those that are having fecal incontinence, especially with constipation, we treat them with something like Miralax or other kind of stool softener. And some just don't eat enough food that have fiber, so we recommend fiber for them. Another category is sleep-wake disorders. This one was so broad, I have to just shorten it the more I should. Because I always preach that healthy sleep is very, very important to restore functioning, vitality, memory consolidation, and actually help maintain our immune function. But a lot of us are affected by sleep disorder. I am number one, I will tell you that. But when it's left untreated, it can actually increase your risk of heart disease. It can cause motor vehicle accidents, because I've seen people doze off and actually rode from one street to another and cause a crash. It can lead to memory problems, depression, as well as impaired functioning. So I listed them the more I could. So we have several. The number one is insomnia disorder, like you just can't sleep much at night. Some will sleep only 1 hour in 2 days, and some may actually sleep 2 hours. Then some are just, I call it hypersomnia, whereas they sleep throughout the night, then they now fall asleep during the day. They just can't sleep enough. Some will sleep up to 14 to 18 hours in this kind of group. Those with narcolepsy, nothing you can do, they just fall asleep during the day. They can fall asleep at the drop of hat on you. So some have obstructive sleep apnea or hypopnea. These kind of people, it's mostly related to their obesity. When they sleep, they snore, they are not getting enough oxygen in. So those are categorized under the central sleep apnea as well as sleep-related hypoventilation or circadian rhythm sleep-wake disorder. Some, they may open their eyes when they sleep. Some may blink when they sleep. Those are non-rapid eye movement disorder. Some may just wake up because of nightmare. Some may be rapid eye movement or sleep behavior disorder. Some have restless leg. They move around and they wake up the following morning and their body ache because they have restless leg syndrome. And some may be substance or medication induced sleep disorder. Like those that are on cocaine, they may not be able to sleep. Those that take indiscriminate stimulants may not be able to sleep. So there are several categories of sleep disorder. The most common one out of all these is insomnia, as well as obstructive sleep apnea. If you've noticing this, I always recommend that get tested for obstructive sleep apnea and get it treated. So they may treat it with BiPAP machine, which produce oxygen to the brain. So in obstructive sleep, what happens most of the time is that the body is not getting enough oxygen, then the body is waking itself up as a defense mechanism to get oxygen to the system. So you notice this a lot, and it's very important to get it treated. Now, let's talk about personality disorder. Personality disorder tend to appear in adolescence or early adulthood and continue for so many years, which cause a great deal of distress. It can cause enormous conflict with other people, relationship failure, as well as even causing the relationship to not develop in the first place. It interferes with ability to function, as well, especially appropriately in social situations, and get in the way of reaching life goals. So it stunted your development and your growth. So I use DSM to categorize everything that I've been discussing so far. So they organize everything into several groups or clusters. And some actually share key features also with each other. Cluster A, I listed this as these three. These personality disorder are actually those that we see as eccentric or have odd behavior. They have major disruption in their relationship because their behavior may be perceived as peculiar, suspicious, or detached. So those with cluster A type, they are the type of personality disorder. So you see that their speech just is not the same as everybody else. Their pattern, their behavior, their appearance just it's not the way normal people should. Then they may also have strange belief. They may say, oh, don't you know? Like, well, I believe that if you go out when it's really sunny outside, birds may start talking loudly to you. This is actually what they believe. You know that that's not normal, but they believe that. They can't form relationship because they believe that what they believe in, you don't believe in it, so you don't have anything in common with them. So it doesn't allow them to form any relationship or develop as people. Some are just paranoid personality disorder. So I see 1% to 2% of adults in the United States that actually suffer this. So they may have a chronic, pervasive distrust of other people. They suspect you even of being deceived or exploited, including friends, family, partner. They just can't bring themselves to trust anyone. They have angry outbursts in response to this deception. And they're very cold, secretive, and exhibit jealous behavior. So those with paranoid personality disorder, you will notice that they can never form an alliance with anyone at work. They tend to stay mostly to themselves because they can't trust you. They don't share project ideas. They don't contribute to anything because they say, oh, what if they steal my project? What if they don't? So most of what they know does not manifest because of their mindset and their personality. Another one is schizoid personality disorder, which is characterized by social isolation and indifference towards other people. They don't care, even if the roof is falling. It affects more men than women. And people with this relative rare disorder are actually described as cold or withdrawn. And they don't have close relationship with anyone, including even their parents. They don't. And they may have a lot of introspection and fantasy, some unspeakable. Moving to cluster B traits. Cluster B traits are the most dramatic and erratic ones. They show this behavior. And they experience very intense emotions or engage in very extreme impulse to stuff. Theatrical, promiscuous, law-breaking behavior. So this includes the borderline personality disorder. They are very, very unstable emotionally. They have intense interpersonal relationship and impulsive behavior. These people are afraid of people leaving them. So some will even slash their wrist to get attention from you to stay. So you can't break free easily from this kind of people. Another one, the histrionic type. They have a way of wanting to be the center of attention. They may actually apply makeup because you're coming to see them, especially we see this in hospital, when they know that a certain doctor that look really handsome is coming, you see them rushing to do makeup because they want that attention. They throw themselves out there immediately because they don't want anyone else to capture other people's attention, but they have to. You see them showing frequent mood swing as well. So one minute they're happy, this next minute you see them crying. So they are very, very dramatic in this way. Another one is antisocial personality disorder. It shows up in childhood. I mentioned the impulse control disorder as well as conduct disorder or ODD, that's oppositional defiance. So with antisocial personality disorder, it shows up in childhood. And most other personality disorder that don't appear until adolescence or young childhood, adulthood, sorry. So it includes disregard for rules and social norm or lack of empathy for other people. Even if their parents crying that, oh, you need to stop this, it just don't move them. They don't have any mercy. And it's because of this personality that they have that needed to be dealt with. So that's the reason why they can't feel. They just can't feel that what they're doing is bad. So they continue on with this kind of behavior. There are some also that shows narcissistic personality disorder, which is associated with self-centeredness, exaggerated self-image of self, and lack of empathy for others. These people, if it's not about them, sorry, can you hear me?
Yes.
Okay. Please, over. So these people are so self-centered that they just feel that they are the most important person in this world. Other people's mind don't matter. So, and they don't feel sorry for other people. And you see a lot more exhibit this kind of personality. Moving on to cluster C, these people show more anxiety and they are very, very afraid. So some actually are very timid. So include dependent personality disorder. They can't really come out to say what they're feeling because they're afraid that they may be alone if they voice their mind. And they want you to take care of them and support them at all times because they really don't have the mind to go out. They have extreme shyness too. So we talk more about OCD, also can be a personality disorder because they have preoccupation with orderliness, perfection, control of relationship as well. So the other one is avoidant personality disorder, which may also show up in childhood. So it's disregard for rules or lack of empathy or remorse. So I will speak briefly about substance-related and addictive disorder. This is a result of use of 10 separate classes of drugs: alcohol, caffeine, cannabis, hallucinogens, and other hallucinogens like LSD, inhalants, opioid, sedative, hypnotics, your anxiety medication, stimulants like amphetamine and other stuff like cocaine and tobacco. And some are actually grouped under unknown substances. So when we diagnose this condition, it actually has to merit you taking this substance in a larger amount or longer than you meant to. Like, you know, your brain is telling you that this needs to stop, or you just continually drink or smoke or do stuff. So it has to be a lot. And your mind is telling you that, okay, this behavior is not good. I need to cut down or stop using the substance, but not managing to be able to do it. Or spending a lot of time getting, using, or recovering from the use of this substance. Some resort to stealing to be able to actually fund these habits. Cravings and urge to use the substance. Like if you haven't had it, you just can't sit still. So all these symptoms is exhibited with those that are suffering from substance-related disorder. Not managing to do your job or home life or school because of substance use, continuing to use even when it causes problems relationship, giving up important social, occupational, or recreational activities because of the use, using substance again and again, even when you put your life in danger, using even when you have physical or psychological problem that could have been caused or made worse by the substance. Needing more of the substance to get the effect that you want, like this, your body build tolerance to it. Then having withdrawal symptoms, which can never be relieved by you not taking the substance. So you have to just take, okay, this is like you having to take the substance for you actually to feel better or take care of the withdrawal symptoms. So I risk what can happen in 4 areas, these 4 boxes. It impairs your control because you're taking it in larger amount over a period of time that was intended. Then there is a persistent desire to actually stop it, but you can't. Then a great deal of time is spent in this, as well as craving and urge to use it. So it's impaired the control. Then the area of the social impairment is using it that actually causing you to fulfill obligation at work, school, and your home life, or using it having persistent issues with social or interpersonal relationship. Then using it causing issues with social, occupational, and recreational activities. Then risky use of substance are grouped that also. That is even when it's physically hazardous, you're using it. Or knowledge of knowing that you have problem or physical issues that you should have make you stop using, but you continue to use. So the pharmacological criteria is when you build tolerance to it or you are withdrawing from it. So whenever someone is faced with sometimes we have family members that's actually having issues with substance-related disorder. Most of the time we do counseling or sometimes send them to where they can actually get rehab. That means taking them completely from the environments where they can have access to the substance and treating them with medication. It ranges. That's why I didn't list anything in particular, because it depends on the symptoms that they're showing. If they're having tremors or withdrawal symptoms from LACO, for instance, we may treat this with Libron or other anti-anxiety medication to help them not to fall sick. Some may actually need to be treated with antidepressants. So the list goes on and on. So it depends on what they're showing, and that's how they will be managed in-house. And some may stay in program for 30 days and receive counseling from trained professional. Some go from each stages from pre-contemplation to change, to actually contemplation to change, then actually changing and doing something about taking care of their disorder. Then some may actually go and attend 12-step program and continue on to stay sober, and they celebrate this by not going over to actually have contact with the substance anymore, because they know that's where they've been through. So not all treatment actually is successful. We've seen a lot of cases where people relapse. So continual encouragement of trying to enroll people in program do help. Or having a family that actually are supportive of their care that can actually make sure they check in and ensure that they're doing everything possible to remain away from those substances. And I want to state here that the use of substance starts with one small, then it continues on to from one stick of cigarette to 10, then from 2 packs to 4 packs a day. So let's be mindful of that.
Yinka is cooking.
Sorry, ọmọ mi ló pé nǹkan náà ó dẹ̀ ti gbàgbé ẹ̀. Ẹ má bínú, nǹkan tí mo máa ṣe pẹ̀lú yìí ni.
Jọ̀ọ́ má bínú sí wa bàbá.
Báwo ló ṣe máa gbé nǹkan kaná tó dẹ̀ máa gbàgbé kó ń gbé nǹkan kaná?
Mọ́mí.
Pẹ̀lẹ́ Yinka, pẹ̀lẹ́ má bínú.
Some of the treatments, I just mentioned some of the treatments here, and I told you I will discuss that at the end of the day. So common treatment that we've seen, you know, for people that exhibit anxiety, we give them anti-anxiety medications. So I'm always very careful with anti-anxiety medication because they can actually be very, very dependent too. So those that show up with anxiety, I treat them more with a class of medication called SSRI. This helps boost their serotonin to help deal with that. So some may just need for you to give them like Valium or lorazepam or stuff like that. So I may do like 14-day supply to allow their other antidepressant to start working, then wean them off of it because it's highly addictive. Then, yeah, I mentioned antidepressant medication that helps with mood. So those with schizophrenia or psychotic syndrome, we treat them with antipsychotic, and more stabilizing medication like lithium, like lamictal, you know, like trileptal and all that. We use those that have bipolar or have issues with mood. Then some need to be hospitalized. So that way we can treat the core existing medical problem or serious complication that occur, like severe disorder or substance abuse, like I mentioned. Sometimes we have to do family therapy to help develop support and understanding. So that way family can be included in the care plan. Family therapy also to help develop support and understanding, like I mentioned. Individual therapy is another one, as well as group therapy. Then cognitive-based behavior therapy, it works on your thoughts and actually patterns and behavior. These we use a lot with those with personality disorders and those with mood disorders too. We want them to think about what they're thinking about and how they're acting. Then the DBT, which is dialectical behavior therapy, mostly used in schizophrenia, it teaches coping skills and strategies to deal with urges that is related to self-harm, suicide, and help regulate emotions as well as improving relationship with others. There's another one called mentalization-based therapy that teaches people to notice internal states of their mind and how to develop empathy for others. So psychodynamic therapy also is it helps to discover and understand past issues and their relationship to current thoughts and behavior. Like what has happened in the past that led you to this way. For example, those who are antisocial, did something happen to them in the past? Those that are really have marked distrust of others, did something happen to them in the past? So we try to tie that in and have them deal with the root of the problem so that way they can move forward to developing coping strategies for their behavior. Then, yeah, another one is support group. So we have several support groups. We have support group for moms that actually deal with children with autism spectrum disorder. We have support group for moms that deal with children that have ADHD, you know, just like that, several categories. Those with personality disorders also have some support groups that are named also in this country. Another class of treatment is the complementary and alternative method. Some just can't take antidepressants. Some people are afraid of weight gain with the antidepressants, so they don't want to take it. It makes some really feel sick and the symptoms is not easing, even if we continue using. So they go to other alternative method that we have. So omega-3 fatty acid, and I want to say here, all these things I listed, I have not seen enough data to actually support their efficacy, but this is out there. So I wanted to sound that. And for everything that we see that they are really harmless, it needs to be checked with your primary care to ensure that they don't have reaction to your medication. Even vitamin may interact with other prescribed medication you're taking. So please, don't just rush to omega-3 acid and say that because Yinka said so that it helps with depression or schizophrenia. So no, please check with your doctor. But this kind of treatment is out there, like taking supplements, folate, medical food. Some people cannot stand gluten food, so they stay with gluten-free food, and it actually helps improve their depression. I've seen that. So these are out there. I've actually placed people on metfolate before, and because their antidepressants stop working, and combination of that metfolate acts as an adjunct to their medication, and they did well. Some take just metfolate by itself and they're doing okay. So, but still, I don't have enough data to support this. Another group is the mind and body treatment, like the yoga, meditation, Tai Chi. Some do well with exercise because it actually helps raise the body's responses and also help with your serotonin too, to boost. Some do the equine or assisted therapy. This is working with horses. Actually, I've seen this help a lot with impulsivity. I use that with my daughter. One of my daughter, the middle one, have the ADHD. So I don't use medication for her because she's able to cope without medication. So, but we teach her a lot of coping skills, and it takes somebody that's actually to be able to calm and deal with horses. And I know she likes animals. So we use this assisted therapy for her as well. So these are some of the things that are out there that are not necessarily have to be medication-based. So I want to talk about how comes for people with mental health disorder. There are risks to watch carefully, obstacles to overcome, improvement to be made with help of treatment. Some just don't recover, unfortunately. This is sad, but the truth. Some achieve greatness, even with mental health disorder. The key here is early diagnosis, support, treatment adherence to actually avoid symptoms relapse. I want to leave this on this note because last time we were talking about, oh, can these people be hired? We don't know who is going to crash a plane. We don't know when mental illness can occur. We don't know who started treatment and who stopped it. People can tell you and fill a form out and tell you that, oh, well, I don't have this, I don't have that. But for people to actually come forward will be that we have to remove stigma. If you're saying that, okay, the basis of employment is for you to not have any kind of mental illness, people will not come forth and tell you that they have it. They will avoid psychiatrists altogether. Then what happens when situation is not treated? It puts all of us in danger. So this is like appealing to all of us that please, when you come across somebody that actually open up to you and tell you that I'm dealing with this, let us look at it in the area of empathy and actually support. Because that support may actually save everyone at the end of the day. I wanted to leave on that note. And thank you very much for listening.
Thank you
very much.
I had to rush through all this.
Thank you.
Amazing.
Yeah,
I thank you.
Thank you so much. That is very deep.
This
That
is
is
amazing.
really deep. Thank you so much. It's
You're welcome. I thought I rushed through everything, but
It's fine.
but what you didn't mention.
I didn't mention a lot. I didn't mention neurocognitive disorders. These are your Alzheimer's, the dementia, all this we have to watch out, especially we have aging parents. We need to make sure we check on them because sometimes they don't tell you that they are becoming forgetful. But we notice, like if my mom called me now several times in a day and saying that, oh, I haven't talked to you or I wasn't the one that called you, we need to start noticing this because I've seen people actually improve with early treatment. So, but because of shame or fear, they're really anxious and afraid that, oh, wow, am I losing my mind already? So let's pay attention to our family members because sometimes.
What about spiritual?
Wait, hold on.
To church.
Hold on, please. Before we proceed, I just noticed that Wale Akinola joined us for the first time today.
Hey.
This is
Today is his
birthday.
birthday.
So we are going to do a live
Happy birthday.
So everybody
Yes.
please on mute. Everybody on
Juwon,
mute.
I'm
this
going to
is not.
sing.
Everybody
Let me
on
sing.
Who
mute.
is going to sing?
Rere,
I
Okay.
am singing.
On
This
the
is not
count of
actually.
2,
This is
3,
not
go.
actually my first time.
Happy birthday
birthday.
to you.
Cha 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 cha.
Happy birthday to you.
Cha cha
Happy
cha.
birthday to you, Wale.
Happy
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 birthday
birthday
to
to
you.
you.
Hip, hip. Hooray.
Hey!
One for good luck and
Yeah.
one for next
I need the
year.
virtual cake.
Happy birthday.
Happy
Thank you,
birthday,
everybody.
Welcome, bro.
Thank you, Juwon. Thank
Cake
you,
Ilanja, be
everybody.
pounded yam.
Everything on
Actually,
my bill.
this is like
Hey,
my.
the first said everything on our bill. Where is our
Yes.
face?
Correct.
I'm
That's a
sponsoring
nice
this
one.
birthday.
This like
Yes. So
actually
yeah,
this like my
Tigalo.
this
So
is like my
is that your
second.
first time? I normally see you
No,
on YouTube.
Audio
yeah.
promise.
This is like my second time live, but all the times I've been joining on YouTube was because I was at work and I can't join due to the nature of my work. I can't join a Zoom class. Today should understand, but now I'm at home, so here I am.
You're welcome.
Thank you.
Welcome.
See you.
Welcome on board.
Where is the birthday?
see you.
Ife? I can
Yes.
collect the delivery room. Just call delivery room. He will come and
Thank you.
deliver something from my house.
It's okay, Pinkpe.
So send all bills to Ife.
Yeah.
She's wonderful.
Madam Owodikoko.
Yeah.
Madam Welfare Officer.
The loan gbogbo nǹkan tẹ́ fẹ́ jẹ ẹ lè jẹ ẹ
Abi.
£5,000.
I like that.
Oh yeah, we love you.
No.
Thank you, everybody.
Madam
Thank
Cash.
you all.
Okay, so questions now. I think Radio was asking a question.
No, if Bimpe mentioned
Bimpe was-
spirituality, of course, that's one
spirituality.
aspect of it. I believe in prayers. Prayer changes things. Prayer helps us do with things too. So,
Good.
I
What
know
of
you know that.
question mark?
So
What
these are
of the ones triggered by broken, like if you are broke, financial wahala?
That's
How can you help us
that's
with
general anxiety disorder now.
No,
but
yeah, well, I won't even call it generalized anxiety disorder because if somebody gives
Since
you
when-
money and that thing is resolved, you don't have any problem. You just broke.
Now,
so I'm
you're-
just saying it's like I'm becoming unstable now, and it's just because of money. Can you just prescribe and send me some checks? I think I'll be okay.
Ife, oh,
So,
Ogamo, you on try, stop it.
you know the fizzy.
Ebi ò pa ẹ́, Ogamo,
Rárá
you
o,
on
bí
try.
tèmi kọ́ o, bí tèló ló ń jẹ, bí tèmi kọ́ o.
Ó wà ókè bàjẹ́, ó ń dán bí glass.
Okay, no problem.
Come away.
No problem.
I have a question.
Okay.
It has to do with PTSD.
Mm-hmm.
But I say GCE. I did my GCE at home grammar school. It's amazing how some things stay for so long. I don't remember what paper we wrote that day. One guy, already conscious be much of home grammar school is so then that road was like
Steep
sloping down.
and muddy.
Some mechanic guy was supposed to be fixing the car, picked up the car and drove down that road, reckless speed. And as soon as he got where I was, at the point, we just left the exam hall. He lost control of the car, began to swerve and swerved directly at me and took out everybody beside me into the wall. Bah! As in that experience, I've never gotten past it. Every time I'm beside the road and I see cars passing, it's like the car wants to come for me, you know. Sometimes I want to close my eyes. So I do believe that I have PTSD because
Actually, yes.
I see how
And you know that, and Juwon, you know that's dangerous. You
How?
need to treat it because you closing your eyes, you can't see, and you driving. because somebody is passing.
No, not when I'm driving. When I'm driving, you know I'm in a car. But if I'm
Mhm.
walking by the road
Oh,
and
okay.
cars are coming, I still get that feeling.
So you become hypervigilant, is that what you're saying?
I believe
Extra
so.
careful.
Like I get those fears. Or it may not even be me. You watch somebody by the side of the road and there are cars passing. I'm like, this guy doesn't get knocked down or something.
So I've seen a lot of counseling that actually work to deal with this, seriously, with this PTSD. It's not so bad, it's a mild form, but it actually can be treated.
I'm stopping live streaming now so that we can help.
I've dealt with stuff like that